Hi, my name is Ariel Lehaitre, physical therapist, Pilates instructor, and Pilates Sante studio owner in Los Gatos, California. And today I wanted to talk about pelvic realignment techniques that you can do at home if you've been told that you have an alignment issue. Many of you probably see practitioners, whether it's a massage therapist or a chiropractor, that says that your pelvis is quote unquote off. And when you get it realigned, you feel a whole lot better in your back or your SI joint or even in your hip. And so there's ways that you can use the muscles attached to your pelvis to gently glide the pelvis or realign the pelvis into a more efficient place to give yourself some relief on your own. And so today I'll show you a real simple technique for that. So if I'm dealing with, say, left-sided pain in my SI joint or my hip or my back, and I've been told that a lot of times my left side looks a little bit locked, looks a little bit rotated, this is the technique I could use. And you would just apply it to the right if you have it on the right. So step one, if you have a partner or someone available, would be to lie on your back and have that person hold on to your ankle and give a very gentle tug to the leg. My opposite leg is bent, and they're just giving a very gentle pull to the left leg. Okay? That's step one. If you don't have someone to do that for you, that's okay. And you're going to move right to step two. And I'm going to teach you step two using a dowel. So at home, this could be something like a broom or a mop or any kind of stick, okay? And you're gonna place the left leg behind, or I'm sorry, in front, the dowel's behind the leg. And then you're gonna start to press the back of the left leg into the dowel, okay? If you don't have a dowel, this can also be done with your hands. But I find that a lot of patients and clients, it feels really good to have the dowel. The dowel stays nice and level. And then from there, the progressive technique is to bring the other leg up. And so as I hold here and press for this isometric contraction, 5 seconds, and I should feel the back of my left leg working, like my hamstring area, and I should feel the front of my right hip working. And after 5 seconds, I release. And I perform that 5 times. And so what I'm doing is I'm kind of toggling the pelvis, so to speak. I'm using the hamstrings and the hip flexors to draw the pelvis or the ilium back into a more efficient position. And once I've done 5 repetitions, I put the dowel down, I place my feet down, and I squeeze firmly into something. Now you can use your hands. I definitely prefer more of a yoga block or a ball. It's something about shoulder or hip distance apart, and I give a really good squeeze. Some of you may even hear like an audible click, click coming from the pelvic area. But if you don't, that doesn't mean you weren't effective in your alignment technique. And once you've squeezed strongly at least one time, you'll then come up into a few little bridges. Just nice, easy hip hinge bridge. Kind of start to get a feel of how does my left hip back SI feel. And do that a few times to ideally kind of solidify this realignment technique that you've just performed. And then once you've done that, you'll come up into standing, walk around, and assess your symptoms. And in an ideal world, you'll start to notice like about 50 to 75% relief of whatever symptoms you've been experiencing within a few minutes of doing that technique. Now, some people have a really delayed reaction and it might not be till the next day. But oftentimes, if you really are misaligned and you're effective in your alignment technique, you'll feel significant relief right after, which is why I love this simple idea. I'd love to hear from you and find out what you guys already do to give yourself relief, or if you've been taught by another practitioner how to align your pelvis, how you do that. Please comment below. And if you'd like more videos like this, please subscribe by hitting the bell icon. Thanks and have a great day.